So, I'm going to be discussing different aspects and facts about dementia. I know many people don't think twice about dementia in their daily lives, and many people only have a general idea of what dementia is and how hard it is to deal with. I have interviewed Dr. Martha Anderson to help answer some of the most difficult questions regarding dementia. Dr. Martha Anderson works for the Carilion Clinic Center for Healthy Aging. She is also involved in significant research regarding caretakers and dementia patients. She is helping to develop better resources for both the patient and the caregiver, and I will post the link to that video below.
I'm Martha Anderson, and I am currently an assistant professor in the Virginia Tech Carilion School of Medicine. I most recently taught in the nursing program at Jefferson College, and I've always been a gerontological clinical nurse specialist, which is an advanced practice nurse. Very early on, I got a job when I was a teenager as an aide in a nursing home, which my mother thought was awful, but I loved. And I have subsequently, in almost all of my education, through a bachelor's, a master's, and a doctorate, focused on gerontological nursing and care of older adults and healthy aging. Dementia is particularly interesting to me. The research is challenging and has been the focus of almost my lifelong work.
So, one of the most important things people need to know is what exactly is dementia. And another thing many people get confused about is the difference between Alzheimer's and dementia. So, if there is a difference, what is it?
Dementia is a progressive disease of the brain that it is not curable, and the most frequent dementia is Alzheimer's disease. The few dementias that we can sometimes stop are not an Alzheimer's dementia, but are much rarer. Alzheimer's dementia affects a significant part of the brain, the substantia nigra, and as the brain disintegrates, it causes changes in the person, not just in their memory, because that's what people sometimes think is it affects memory, but it affects ability to move, it affects personality, and it eventually, as it progresses, can cause the person to be completely dependent on others for all care. And at some point in time, they become unable to walk, to feed themselves, or to take care of their toileting.
So, is dementia actually just a natural part of aging? And would everyone with memory loss actually have dementia?
Dementia is certainly not a healthy part or normal part of aging, but age is the number one risk factor for developing a dementia. People after age 85 tend to have about a 47% chance of developing a dementia. Now, memory loss does kind of go with aging, and we think that's basically because of some changes in the brain that cause us to have slower recall, slower reaction, and it takes us longer to learn new information as we age, but this is considered healthy aging. Dementia is a disease. Alzheimer's is the most frequent disease of dementia, but they are certainly not normal aging.
So, who can actually get dementia? Is it just elderly people, or can younger people get dementia? And does it have to do with anything else like family or genetics or anything like that?
Anybody can get dementia. Age is the number one risk factor, but it cuts across gender, it cuts across cultures. It is an international problem because our entire society is aging, and males and females get dementia. With age being the number one risk factor, people usually get dementia in their 70s or as they continue to get older, but there have been some diagnoses in their late 40s and 50s.
So, what are some of the earliest signs of dementia that people need to start looking out for?
The early signs of dementia tend to start with forgetting things that you've always known. For example, a woman who makes an amazing pound cake and can't follow the recipe, or someone who's never had trouble taking their medications forgets medications. Someone who's been very competent as a driver gets lost going somewhere. People always have some difficulties with organization if they live in a cluttered environment, if they're not basically organized themselves. So in the early symptoms that people will complain about with statements like, I'm afraid I'm getting Alzheimer's disease, or I'm having more memory loss than most of my friends, the number one thing that we as clinicians must learn is that we need to listen to that, because people have good insights into whether they are having more difficulties than they should be. That being said, people do have some increased forgetfulness with age, some people more than others, and some people it starts much later than others. I certainly know 90-year-olds, 96-year-olds who have almost no memory loss, but I have some friends with 60 who have Alzheimer's disease.
So when a patient has progressively bad dementia, are they oblivious to their symptoms, or are they aware of what's going on?
The topic of insight is a recent study focus in Alzheimer's disease. Do people have insight into their memory loss or not? The answer seems to vary. Some people have insight very early on, and that may even cause them to ask for help, go for an annual physical and say, I'm worried about my memory. Other people don't have insight until the moderate stages, when they start to feel different. And they'll feel, I've had people complain of their brain or their head felt like things were going on in it. And this is before anything shows up on CAT scan or MRI. Newer studies are looking at PET scans, which is still under research, but that PET scans are showing pathophysiology changes more than the other sorts of radiological studies.
So are dementia patients competent, and can they really communicate exactly what they want?
Incompetence is a legal judgment that's based on two physicians judging a person unable to make decisions for themselves. So it involves a medical evaluation, but for someone to be declared incompetent, it actually occurs within the judicial system with an attorney, with a lawyer and a judge. And all people with dementia do not need to be declared incompetent. It's really important that early in the stage of early memory loss, or just with advanced aging, that we all get an advance directive that says, if I am unable to speak for myself temporarily or permanently, I have someone who knows what I want, and I have signed a paper saying, let them speak for me. Dementia patients can usually communicate what they want. Sometimes if we have difficulty communicating with them, it's because we are doing too much talking and not enough listening. And we also have to be able to use the nonverbal signs and cues. For example, someone in the late stages of dementia may not be able to say, I need to go to the bathroom, or I'm cold, but we may notice that they're shivering, that they're sitting there with their arms around themselves, or that they're up pacing but can't quite find the bathroom, or put words to their need. So we get to know them.
So dementia patients will typically ask a question more than once, or get the date wrong, or have other daily facts or things that they might know and get them wrong. So should we really correct dementia patients when they're wrong?
When people with dementia make a mistake in what they're saying, it usually only leads to frustration if we correct them. However, it's good to try to seek clarification. Sometimes people with early memory loss and early cognitive impairment will repeat themselves, and we tend to say, you've told me that, I've already heard that. But they don't remember that they've already said it. So it's better not to correct, but to try to look for meaning in what they're saying. It might be, tell me what you did today, which is their way of saying, I like to talk with you, but I don't have any cool new questions. Or it might be, I want to go home, which is their way of feeling uncomfortable with where they are. So we just want them to feel secure. So we might say things like, you're going to go home this afternoon. Right now you're here with me, and we're going to have a good afternoon. We're going to go for a walk. Just talk about the weather. Just engage with them.
So on a more complicated note, I know, like with my great grandmother, she would think someone was here that's not here anymore, that they're not alive anymore. So, should we correct them and tell them, oh, your husband died 50 years ago or however long ago? Or should we just not say anything at all regarding that issue?
When older people or people with dementia start asking for people who've passed on, there are several things that can mean. One is they might be remembering them, because often with our memory loss, we forget short term first, mid-term later, and longer term later. So they may still be looking for their spouse. The spouse is right there, but the spouse is 40 years older than they remember them looking, so they don't recognize them. Sometimes people look for people who are dead, and if we say, your husband is dead, he died 12 years ago, they may hear that like the first time, which of course makes them feel sad and distraught, and why didn't you tell me? Why didn't you let me go to the funeral? Even though of course they did go to the funeral and were told. So it's usually better to provide some consoling comments like, oh, you're talking about Dad. Wasn't he the best father? Remember how we used to go hiking together? Or I remember Granddad when he was chopping wood or running the tractor. Or, just talk about him so that she can visit his meaning and his essence without ever saying he's dead or without implying he'll be home shortly, neither of which would be comforting.
So, is dementia actually fatal?
Most dementias are fatal. Alzheimer's disease can kill you. Cerebrovascular dementia, Lewy body dementia, causes failure of the body over time. There are some things that look like dementia, often things that are due to metabolic abnormalities, medication problems, that look like dementia, but they are corrected once we figure out what's causing them.
So, can someone actually become aggressive because they have dementia?
Aggression and agitation are one of the most frequent symptoms and can occur at any stage, early, moderate, or late. And aggression is one of the most difficult symptoms for family members or caregivers to deal with.
So, how hard is it to be a caretaker? And is it harder for someone to care for a dementia patient if they are directly related to them? And what are some important things that caretakers need to know?
Caregiving can be one of the most difficult jobs that someone takes on. And it can also be a rewarding job, but it is still stressful. We say that it's important for a caregiver to take care of themselves so that they will be able to take care of the person with dementia. It's really hard for people to see someone slowly declining. It's hard to understand that they can look the same, still walk around, still enjoy lunch, but not be able to converse or share in the things that we've always shared with. So some people describe caring for someone with dementia as a slow death or a long funeral, because you lose little pieces of someone all along. It's really important for caregivers to become educated about the disease, to seek support and counseling, whether it's through their pastor, a licensed professional counselor, an Alzheimer's Association support group. These are excellent means to learn from other people some tips that are helpful and some that they have found to be really beneficial.
So, can dementia actually be prevented, and if so, how?
The prevention of dementia is very much a topic of research. And we do have a rat model for dementia in rat model studies, but we have not found a way to prevent it or to treat it successfully yet. The few medications we have don't tend to do anything right now other than delay progression for a year or two. As far as the best strategies we know of for preventing dementia, it's really based on healthy living, and what's good for the heart is good for the brain. We found that regular exercise is one of the best things to prevent dementia. We also have found that healthy eating, particularly the Mediterranean diet, seems to show lower numbers of people who develop dementia.
So, are there any more myths or misconceptions that people typically have regarding dementia?
People who worry about getting Alzheimer's or getting a dementia from people that are near them, that's a myth. You can't catch dementia. It's something that goes on in the brain. There are some other diseases that affect the brain, like encephalopathies and mad cow disease, that are different entities than the typical dementia or Alzheimer's disease. As far as misconceptions, people assume that people with dementia can't understand what they're saying or don't know what they want to say, and they usually can very, very late on in the disease, but sometimes we have to figure out ways of saying it better to them so they can answer better.
So, are there currently any advancements being made on the prevention, cure, and care for dementia?
Well, there's multiple research going on in dementia across many professional domains. For example, medicine is looking for different medications and different studies, and there's been some good work that shows that PET scans will actually give us news about dementia before anyone has symptoms. Research is currently trying to find those early stages, because that's when we can change the course of the disease and prevent the debilitating decline that goes with the progressive disease now. Social work has developed some wonderful counseling strategies for both caregivers and for the person with dementia. Nursing has developed many strategies that help with caregivers and help with taking care of someone. A typical example is we assume that someone can't do the things they used to do, like brush their teeth. But we have learned that if we break down what they used to do into short, understandable instructions, for example, let's go brush your teeth, let's go to the sink, now pick up your toothbrush, now pick up the toothpaste, put the toothpaste on your brush, turn on the water, wet your toothbrush, and you just go through step by step, and then they feel good because we're not doing something to them all the time. They are able to do it. But it takes time, it takes patience. And yet when we take the time to develop those little routines, people do stay functional much longer.
So now that we've talked about all the different aspects and concerns regarding dementia, why should people actually care about the facts of dementia, even if they don't have anybody in their family with dementia, or if they're not concerned about getting dementia themselves?
Well, knowledge is power. And knowing about dementia and how debilitating it can be can guide us to assure people of the importance of healthy living and good, healthy diets. Also, when people start having symptoms and they start hiding it and not wanting to tell people, I can't ever find my car keys anymore. I used to always put them in the same place, and now I find them all over the house. Then we can say, I can see why that concerns you. Let's make sure we put that on the list when you go visit the doctor next month, or let's make an appointment to go visit the physician next month. And if people start to become depressed, either the caregiver or the person with dementia, that can be very debilitating. So it's really important that we go ahead and get treatment for the depression, medications, and counseling. The two together are much more beneficial than either one alone.